Hi folks, Dr. Byer here today. Today we're going to talk about depression, which is rampant in our society. In fact, antidepressants are one of the fastest growing prescription that we have in our system, and brain inflammation and gut problems. Now, what depression really is, it's when your frontal lobes in your brain are fatiguing. It's really brain fatigue, and you lose the desire to do things, no motivation, life's not worth living, the glass is half empty instead of half full. We can go on and on about all the cognitive changes that occur. What I see clinically, one of the most common underlying causes of depression is when the brain becomes inflamed. Nothing will shut your frontal lobes down quicker than brain inflammation. And another common symptom that we'll see with that is patients will complain of brain fog. Now, I'm going to talk to you about how the gut relates to this. The main source of inflammation is our gut, or our gastrointestinal system. 80% of our immune system resides in our gut. In fact, most serotonin and dopamine is actually made in the gut, and these are the neurotransmitters needed by the gut's nervous system and our brain's nervous system, brain function. Now, some of the causes of inflammation in the gut are hidden infections. We see this all the time. People come to me, we run a simple stools test, and they got parasites, yeast overgrowth, H. pylori infections, and on and on and on, and they don't even know it. In fact, about 80% of my patients have gut infections and don't know it. Food sensitivities. Folks, the food we're eating nowadays has been genetically modified. It's not the same food we ate 20, 30 years ago, and a lot of our immune systems aren't recognizing it as acceptable, and they think it's a germ, and they attack it, causing inflammation. Dysbiosis, or small intestinal bacterial overgrowth. This is where the gut flora, or the good bacteria in our gut, is out of proportion. Autoimmune disease like Crohn's or ulcerative colitis and celiac disease are another cause of chronic inflammation in the gut. And leaky gut syndrome. This is where the barrier of our gut is permeable and things are making their way into the body that don't belong in the body, and the immune system reacts to them. Now, all of these things in the gut are going to cause an increase in chemical messengers in the immune system that are called cytokines. These cytokines are going to get absorbed into your bloodstream readily from the gut, and then they cross the blood-brain barrier. Once these cytokines are in our brains, they react with the brain's immune system. In fact, for every neuron we have in our brains, we have 10 immune cells called microglial cells protecting it. So any type of inflammatory situation in the brain really, really devastates and limits the functioning of our neurons, especially in the frontal lobes. And so then we get inflammation of the brain, and as I said earlier, inflammation of the brain will shut down the function of your neurons, and if it attacks the frontal lobes, you will be depressed. So I'm Dr. Byer, and I'm letting you know that there's so much that can be done to correct the situation. Modern medicine doesn't look at this at all. We do. I'm going to be holding a workshop this Wednesday evening in my clinic at 6:30 p.m. on underlying digestive orders and how they impact brain function. I'm Dr. Byer. Have a great day.